What if I told you that millions of people are waking up every single morning, gripping their bedsheets, wincing before their feet even hit the floor, and they don't have to be? And what if the answer wasn't another prescription, with a list of side effects longer than your grocery list, but something far simpler? Today, we are going to talk about the top 3 joint supplements that are actually backed by science, and that real people just like you, are using to take back control of their lives. But here's what makes this video different. We are not just going to name them and move on. We are going to go deep. We are going to talk about how each one works inside your body, what the research actually says, and, most importantly, how to use them correctly so you actually feel the difference. Stay with me, because by the time we get to number 2, I think you're going to be genuinely surprised. Before we dive in, I want you to think about something. Arthritis is not just getting old. It is inflammation. It is cartilage breaking down. It is fluid in your joints drying up over time. And when that happens, bone starts rubbing on bone, nerves get aggravated, and that deep, aching, sometimes burning pain becomes part of your daily routine. That's the enemy we are fighting today. Now let's talk about the 3 supplements that have the most evidence, and the most real-world results behind them. The first one is glucosamine, and if you've had sore joints for any length of time, there's a good chance you've heard this name before. But most people don't actually understand what it does, and that's why they take it wrong and give up too soon. Glucosamine is a compound your body actually produces naturally. It's one of the key building blocks of cartilage, that cushion-like tissue that sits between your joints and keeps movement smooth and pain-free. The problem is, as we age, our bodies make less and less of it. Think of cartilage like a sponge. When you're young, that sponge is full and flexible. As the years go by, it starts to dry out, thin out, and lose its ability to absorb the pressure your joints deal with every day. Glucosamine, as a supplement, helps slow that breakdown, and in some people, it even supports the regeneration of cartilage over time. Now here's what the research says. A major study called the GATE trial, the Glucosamine a chondroitin arthritis intervention trial, funded by the National Institutes of Health, found that people with moderate to severe knee osteoarthritis experienced significant pain relief when taking glucosamine combined with another supplement we'll talk about in just a moment. The typical dose that research supports is around 1,500 milligrams per day. And this is critical, you need to take it consistently for at least 8 to 12 weeks before you judge whether it's working. Most people quit after 2 weeks and say it didn't help. That's like planting a seed and pulling it up before it has a chance to grow. Real healing takes time. One more thing to remember, glucosamine is often derived from shellfish. So if you have a shellfish allergy, talk to your doctor about a vegetarian alternative. Alright, that's number 1. Now number 2 is where things get really interesting. Chondroitin sulfate. This one is almost always paired with glucosamine, and there's a very good reason for that. While glucosamine helps rebuild cartilage, chondroitin works in a completely different way. Its main job is to retain water inside the cartilage. Remember that sponge we talked about? Chondroitin is what keeps it wet. It draws water into the cartilage tissue, keeping it thick, bouncy, and resilient. Without adequate chondroitin, your joints literally become less cushioned with every passing year. But here's the piece that stops most people in their tracks when they hear it: chondroitin also has anti-inflammatory properties. It actually blocks enzymes in your body that are responsible for breaking down cartilage in the first place. So while glucosamine is building the house back up, chondroitin is stopping the wrecking ball. Together, they form what many rheumatologists and integrative medicine doctors consider one of the most well-supported natural combinations for osteoarthritis relief. A 2015 clinical trial published in the Annals of the Rheumatic Diseases, one of the most respected journals in joint health research, found that chondroitin sulfate performed comparably to a common prescription anti-inflammatory drug in reducing knee pain and improving joint function. That is not a small finding. The standard recommended dose is between 800 and 1,200 milligrams per day, usually split into 2 doses. And just like glucosamine, consistency over months, not days, is what delivers results. Here is a little tip that a lot of people overlook. When buying a glucosamine chondroitin combination supplement, look for products that use pharmaceutical-grade chondroitin. The quality of chondroitin can vary enormously between brands, and lower-quality versions may not be absorbed by your body effectively. Do your homework, read the label carefully, and if you're unsure, ask your pharmacist. They are genuinely one of the most underutilized resources for older adults managing joint pain. Now we come to number 3, and I want you to really pay attention here because this one surprises people the most. It's omega-3 fatty acids, the same thing found in fish oil, and before you say I've heard about that for heart health, let me tell you why it belongs right here, at the top of this list for arthritis. The root cause of most arthritis pain is inflammation. Your immune system, for a variety of reasons, starts triggering an inflammatory response in your joint tissue, and that inflammation is what causes the swelling, the stiffness, the heat, and that grinding pain that just won't let you rest. Omega-3 fatty acids, specifically EPA and DHA, are among the most powerful natural anti-inflammatories we know of. They work by interrupting the biological pathways that create inflammatory chemicals in your body. They essentially turn down the volume on the fire that's burning in your joints. A comprehensive review published in the journal Rheumatology found that omega-3 supplementation led to meaningful reductions in joint pain intensity, morning stiffness, and the number of painful joints in people with rheumatoid arthritis. And more research is now showing similar benefits for osteoarthritis as well. The dose that appears to make the biggest difference in clinical studies is between 2,000 and 4,000 milligrams of combined EPA and DHA per day. Now, this is important, not just total fish oil, but the actual EPA and DHA content on the label. Many fish oil capsules only contain 300 milligrams of combined EPA and DHA per pill, which means you'd need several capsules to reach a therapeutic dose. Read the small print on the back of the bottle. If eating fish a couple of times a week is realistic for you, salmon, sardines, mackerel, that is also a beautiful way to incorporate omega-3s naturally. For those who don't eat fish or follow a plant-based diet, algae-based omega-3 supplements are an excellent alternative and actually the original source that fish get their omega-3s from. So let's bring this all together. If you're dealing with arthritis pain, whether it's your knees, your hips, your hands, or your spine, these 3 supplements form a powerful, science-supported foundation: glucosamine to rebuild and protect your cartilage, chondroitin to keep that cartilage hydrated and block further breakdown, and omega-3 fatty acids to fight the inflammation that's driving your pain every single day. None of these are magic. None of them work overnight. But used consistently, at the right doses, as part of a lifestyle that also includes gentle movement, a diet rich in vegetables and whole foods, and regular conversations with your healthcare provider, they can genuinely change what your mornings feel like. And that's what this is really about, isn't it? Not just managing pain. It's about waking up and being able to walk to the kitchen without bracing yourself. It's about playing with your grandchildren without paying for it the next day. It's about getting your life back, one small step at a time. Before you go, do one thing for me: share this video with someone you know who wakes up every morning fighting joint pain. Because they deserve to know that there are options, and that feeling better is not just a dream. It's a decision. Take care of yourself. We'll see you in the next one.